Good evening. My name is Alantia Sorrendo. I will be presenting the education plan for the Shadowville community. Today is January 15, 2023, and I'm in class NUR 444L. I will start off by talking about the risk for cardiovascular disease. Heart diseases or cardiovascular illnesses have become a critical challenge in the global community. Research by Hamer et al. 2020 estimates that about 17.9 million people face the challenge of cardiovascular disease globally. Likewise, the Shadowville community faces a high risk of cardiovascular diseases. A keen assessment of the community reveals that most live sedentary lives. According to Hamer et al. 2020, the lack of good wellness and community fitness program intensifies the burden of cardiovascular diseases. Most of the population in the community does not utilize recreational facilities for physical exercise. Consequently, a lack of physical activities may alter the heart's normal functioning, including the free flow of blood, thereby increasing the risk of cardiovascular diseases. Risk for cardiovascular diseases continue. Macias et al. 2021 state that high blood pressure is the primary form of cardiovascular complication. Research by Macias et al. 2021 also highlighted normal blood pressure ranging from 90/60 mmHg and 120/80 mmHg. However, high blood pressure is anything higher than 90/60 Hg and 120/80 mmHg. Various strategies can be adapted to control and prevent various forms of cardiovascular diseases by eating healthy food, avoiding drug abuse, carrying out physical exercises, and embracing regular medical checkups. Environmental hazards. Environmental hazards have the potential to cause harm and compromise the quality of life in a community. Environmental hazards possess a critical health threat to the Shadowville community. The community's major hazards include biological, electrical, chemical, and noise. Besides, the community also faces the risk of natural calamities or threats, including floods. According to Dashkova and Ignatova 2020, environmental hazards have devastating health and socioeconomic factors such as physical injuries, illnesses, and the spreading of diseases. Environmental hazards continue. According to Yukago et al. 2020, environmental hazards can cause detrimental effects on the community if proper mitigation and management strategies are not initiated. Therefore, creating a mitigation strategy is necessary for safeguarding community health and promoting safety and overall quality of life. Yukago et al. 2020 also determined that involving and educating the community are essential for promoting the outcome of the mitigation process. At the same time, it is necessary to involve local authorities like the Community Health Institution and Disaster Preparedness Team in case of a suspected hazard. Respiratory diseases. With the level of air pollution across the globe, many communities face an elevated risk of respiratory diseases. According to Macias et al. 2021, respiratory issues are any condition affecting the breathing system. Therefore, various behaviors and factors increase the risk of respiratory illness. For instance, smoking, exposure to dust, and poor working conditions increase the burden of respiratory diseases. Exposure to various chemicals also elevates the risk of various respiratory illnesses. Common respiratory conditions likely to affect people in Shadowville community include chronic obstructive pulmonary disease, COPD, and asthma. Respiratory diseases risk management. According to Blanc et al. 2019, various health, social, policy, and workplace changes are necessary to control respiratory risks. Therefore, educating the community about respiratory risk is essential for managing the challenge. Creating work reform also shields the community from respiratory conditions. The author further determined that educating workers on the need for safety gear when dealing with hazardous chemicals is important. Blanc et al. 2019. Controlling respiratory issues lowers the burden of healthcare in the community. Thank you.